Thanks everybody for being here and for your patience. Over the last week, we have seen record increases in our COVID positive cases. We have seen increased hospitalizations, and it's become clear that the public needs more guidance from its state government in terms of what they should be doing to combat the spread of this virus. But unfortunately, the public has not been given that guidance, specifically has not been given guidance from the governor. We are, in the House Democratic Caucus, proposing a system that would give the public more guidance on a day-to-day basis on how they should be conducting themselves, how they should be combating the spread of this virus. This would be called the Oklahoma Virus Alert Program. The levels are here to my left. The goal of this system is to make Oklahomans better prepared on a daily basis to combat viral infections. In this instance, obviously, it would be the coronavirus, but this system could be used for any type of viral infection that is spread from one person to another. This system is most importantly data-driven. It focuses on how much the virus is spreading. It does not mandate behavior, but it does provide guidance to the public. There's minimal cost. We're already collecting this data. We see the number of cases, the hospitalizations, the deaths every day from the health department. And it's simple and easy to understand. We know that systems like this are used in a number of instances, and this system itself is actually being used in the UK right now to inform the public about the spread of coronavirus. This issue is not partisan, although sadly some have made it partisan. We just saw comments yesterday or the day before from Republican Governor Greg Abbott of Texas. He is recommending mask wearing, said that the virus is spreading at an unacceptable rate. He's recommending social distancing and telling citizens that they should be staying home as much as possible. In contrast, Governor Stitt won't be firm in recommending mask wearing. He has said that he's not sure whether he will wear a mask, and frankly has seemed to discourage mask wearing and its effectiveness. He participated in a public rally while not wearing a mask. He, instead of listening to subject matter experts on the issue, public health officials told the governor that the rally shouldn't take place, but instead of listening to those subject matter experts, he kept repeating this talking point of when is the right time to hold a public event. Ignoring the health community is not the leadership that Oklahomans deserve during a pandemic. It's obvious that Governor Stitt, due to his loyalty to his political party, was not going to do anything to hinder last weekend's event, while public health experts both in Oklahoma and across the nation were saying that that rally was a bad idea. The governor was on national television making jokes about presidential politics. Oklahomans deserve their governor to be loyal to them instead of any political party. And most importantly, Oklahomans deserve real leadership during this time. The Oklahoma Virus Alert Program, using data and the experience of public health officials, would provide the governor and the public with the information that we need. Finally, we see this as an economic issue. We are seeing businesses across both of the large metros in Oklahoma City and Tulsa. We're seeing businesses who are having to shut their doors again because of the spread of the virus. They're having employees who are catching the virus, and some of them are making the decision because people frankly don't feel comfortable going to these businesses. And the worst thing, as we've said for months now, the worst thing that we could do is have yet another economic shutdown. But right now, people don't have the information. It's not being given to them in an easily digestible manner, and they're not receiving guidance from their government in terms of what they should and should not be doing. So the virus alert program would provide them with that information and guidance, and would provide businesses with important guidance that they need. Businesses right now are forced to make their own decisions based on just what they're reading on the health department website. They're being forced to make decisions based on anecdotal evidence that they're hearing from the public and from their employees. And that's a shame, because businesses deserve, and the public deserves, real guidance about what they should and should not be doing. So we are hopeful that Oklahoma will implement this program or something very similar, and that the public will be given the guidance that they need, businesses will be given the guidance that they need, and we will avoid not only unnecessary transmission of this virus, but also another economic shutdown. We heard Mayor Holt yesterday talk about this being a critical week for the spread of coronavirus, and that if the trend continued, that he thought that that Oklahoma City at least would be going back on some of its levels in terms of the reopening plan, so that businesses may be forced to shut down again, or they may be at reduced capacity. It's a shame that once again we are seeing a lack of leadership from our state leaders, and that mayors like Mayor Holt are being forced to provide the only real guidance that we're seeing in this state. With that, I will take any questions. Yeah, Paul?
Where would we fall right now on the scale?
Right, so level 4, because we are seeing that transmission is high and rising. So this would recommend that public spaces would be operating at a 25% capacity, like restaurant dining rooms and other indoor spaces. And so I know that many restaurants are already cutting back on their dining room capacity, and so this would provide them with that guidance.
And these are recommendations, not necessarily enforceable rules?
Correct. Yes, these are recommendations, and they would provide businesses with recommendations, people with recommendations on what their behavior should be. We know that mandates aren't working very well in many places, and I don't think that we're at that time yet. But if public health officials said that we needed to mandate something, then I think that we should listen to them.
Is this kind of your answer too? Like you mentioned Holt yesterday, you could tell that he wanted to do something, but he knew that any kind of step backwards would be a big, huge deal. This makes stepping forward with that probably easy.
Yeah, so you can easily move from one level to another on any given day. And so today we could be red, tomorrow we could be orange. And that would provide each person, each business with the guidance each morning in terms of how they should be going about their day, how they should be conducting their business.
Would this be localized? So if you had a pocket in one area, would it be localized for that one area, or would it be statewide?
So what we saw in terms of these localized decisions when the virus first came to Oklahoma, what we saw was that we had very localized decisions, but we know that people can travel from one place to another. If public health officials felt that this should be localized, then I would absolutely go with them on that. But I think that it's important for us to have statewide guidance, because in the beginning we did not have that statewide guidance, and we still don't have it.
In Texas, I believe in Austin, the masks are mandated now. Is that something we would want to ask Governor Stitt to enable mayors, if they think that their city needs that, to actually have an enforceable requirement?
Absolutely. Local control is very important on this issue, especially because we haven't seen the leadership from the governor. Really, the only guidance that we're seeing, the only leadership that we're seeing is from those mayors, from those local governments. And so we absolutely want to continue that local control. But if a locality was listening to its public health experts and they thought that a mask mandate was necessary, then we would support them in that, because they're very close to what's going on the ground in these areas. But frankly, at the state level, we're still having a conversation about whether masks even work or not to prevent the spread of the virus. Even though public health officials have pretty much reached a consensus that mask wearing is very important to prevent the spread of the virus, what we're seeing from the governor is, frankly, he's making it a political issue, and sadly, that's been the case across the country with the president's comments as well. He sees it as a political issue. It's not a political issue, it's a public health issue. It's about doing what you can to protect citizens and protect your neighbors.
So is the program, how will this be enforced? Will this come about in the next session?
Well, we hope that this could be implemented any day now. This is something that would be very simple for the governor and the State Department of Health to implement today. They may have to come up with some definitions or get into some specifics, but this is something, like I said, it's simple, it's easy, because we're already collecting this data, but right now it's not in a very accessible manner, and there's no guidance that goes along with that data.
What would you compare this to that we already have? I guess fire danger?
This could be, yes, fire levels, the Homeland Security threat levels that we see. This would be based on that as well. So this is something that the public is already familiar with. The colors go pretty easily with what we see in other systems, and so the public knows how to use a system like this.
Governor Stitt said that, you know, if our cases rose, if our hospitalizations rose, we would roll back in the three-phase system, which we're now in the last phase of. Do you think that he's actually been willing at all to sort of roll back on that system, or maybe reevaluate where we are in those phases?
Governor Stitt has not been willing at this point to really even discuss the virus with the public. He doesn't recommend mask wearing at this point, and so, as I said, it doesn't seem like we're even at a point where the governor is considering what the public should be doing on a day-to-day basis, let alone whether we should be going back on the opening up plan. I would hope that he would take seriously what he said when we started reopening, and that was that if our case numbers rose, if our hospitalizations rose, if we saw a diminished capacity in hospitals, that he would go back on some of the phases. And I truly hope that he is serious about that, but at this point, it doesn't seem that he is. All right.
So,
Yeah.
just a follow-up question. So, do you have, or have you been able to talk with the health department about enforcing this? And if they aren't on board with it, what's the next step?
Yeah, this is something that I'm proposing today, and so the health department will be aware. There wouldn't be any enforcement mechanism from the health department standpoint. They would just be collecting the data and deciding which level we're at on any given day. And so with the data that they collect and the guidance that they're giving, this would be something that they could easily implement.
Do you think that county and municipal governments have the authority right now that they could implement something like this themselves?
Absolutely. If the State Department of Health, if the governor doesn't want to implement this, this easily could be something that cities and counties could implement on their own with their specific data for their area, or frankly, they could just look at the state data and apply that to this system to provide more guidance to their citizens.
You said that you were just unveiling this now, but you talked to people across the aisle. Is there Republican support?
No, unfortunately, again, we're mostly getting silence from Republican leaders on the spread of coronavirus in general. I've been talking pretty much every day about increases in cases, what people should be doing. We're not seeing that from Republican leaders right now, and that's why we felt that it was important for us not only to point that out, but also to provide a solution to provide the public with more guidance.
Can you briefly go through like each level from the lowest to the highest?
Yeah, so level 1, which would be green, is that transmission risk is low or none, and that we are seeing very low numbers of cases. Yellow would be that case numbers are elevated, social distancing is recommended. Level 3 is that the virus is in general circulation and residents are urged to wear masks and socially distance. Level 4 is that transmission risk is high or rising. Public spaces should operate at a 25% capacity. And then level 5 is that the transmission risk is severe and the hospital capacity is low, and residents would be urged to shelter in place at that point. So once you go up each level, so if we were at red, like I think we would be at today, all of the recommendations from yellow and orange and red would apply. So mask wearing, social distancing, staying home if possible, and limiting capacity at public places. All right, thanks guys. And thanks to those of you who were working last weekend in Tulsa and were put through some difficult circumstances, but the coverage was really great. So thanks to those of you who were there. Thank you.